normally describe trauma as a three-headed monster, meaning you have trauma patients, could be anything from a gunshot wound to a slip and fall, broken hip, to a slip and fall, hit your head, to a car crash, ATV accident, to emergency surgery. That might be something that comes in through the emergency department, small bowel obstruction, gallbladder disease, appendicitis, and then critical care, which is the ICU, which are the sickest patients. Additionally, in our current practice, we offer kind of elective surgeries. So if you're referred from your primary care provider for something like a hernia, we could do that as well. Critical care has always been a passion of mine. Being there for patients and their families on their worst day, to me, is like one of the most impactful things that I do. So not just being there for patients themselves, but going back to the ICU, the patient may not remember anything about their stay, but the family member is always going to remember. Because ultimately, sometimes that's all that you can do, is just show the patients and their families that you care and that you did your best.